let's now turn our attention to the worrying concern of the COVID spike that we are seeing. Now, the latest is that the Delhi High Court has asked the aviation regulator to put airline passengers violating COVID norms on the no-fly list, emphasizing the need to enforce COVID-appropriate behavior, especially in enclosed spaces like the aircraft and the airport. The court also asked the DGCA to authorize flight crew to take strict action against passengers and others who violate the masking and the hand hygiene norms. That is an important update coming in from the High Court there. But meanwhile, as far as the numbers go, India has reported about 4,041 new cases in the past 24 hours. This is the highest in almost 3 months, when India's case count was around 4,194 on the 11th of March. Yesterday, India recorded 3,712 COVID cases. Now, with the new record COVID cases, country's active caseload stands at about 21,177. Meanwhile, let's also talk about the situation in Maharashtra. Now, Maharashtra Chief Minister Uddhav Thackeray chaired a meeting with the task force in view of the rising cases and appealed to people to wear masks to avoid restrictions in the state. Now, in the meeting, the minister added that the government will keep a watch over the situation for a fortnight and take tough decisions if the need arises. Now, remember, Mumbai has recorded 704 new COVID cases in 24 hours. This is the second day that more than 700 cases have been recorded. Meanwhile, a COVID cluster of sorts has erupted in IIT Bombay, where there has been a rise and there are about 30 positive cases that have been reported in the past 3 days. Well, let's get in some more perspective over the situation at this point in time. Joining me at this point on the show are Anil Goyal from the IMA and Dr. Sanjit Sashidharan as well. Thank you so much, both of you, for joining in. Dr. Goyal, let me come to you first. How worried would you be right now? Of course, the numbers are still low, especially when we compare them to the past waves. But nonetheless, the spike is quite significant.
So what you have said is that, do we need to worry? I would say no. Okay. Only thing is, yes, we need to be alert now. As you are saying, the percentage positivity rate in Delhi is around 2%. Out of 8,000 odd cases tested, around 400 has come positive. But the good thing is that we are not having hospital admissions has not increased. That's one. And also the hospital oxygen beds are not being occupied. That's number two. And why this surge? I think this is the question which we need to ask. The question here is that because it's a hot weather, 45 degrees, 44, 42 degree temperatures, and the people are indoor in a closed environment, in air-conditioned environment. Possibly that's the reason that these cases are on the higher side. So what we need to do, you have aptly put the heading of this debate. Don't drop your mask. I think that is the question. That is the need of the hour, that we can't drop our mask. We can't have poor hygiene. We need to maintain hand hygiene and respiratory hygiene. We need to maintain the distance, which is 2 meters. So everybody needs to understand that if you do not want social sanctions, if you do not want economic sanctions, you need to follow COVID appropriate behavior. Though, yes, it is a matter of concern, but not a matter of worry. People have now understood that they need to follow a COVID appropriate behavior. It needs to be strictly enforced. As you said in your bulletin, that in the airport and in this flying, in the flying machines, you can't do away with the mask or the distancing. We do not want the situation where we have to have the alternate seat in place and the cost will go up. So we need to understand that this is the time. Please take care of COVID appropriate behavior, or else we know that few of our homes, everybody is now down with COVID. But surely this is not a serious thing, possibly because of the 200 crores vaccination, which has been provided by the government of India. And people are now having the booster dose also. So possibly it will not become serious unless the new variant comes. But surely there is surge in cases. We need to be alert. We should not panic. The community should not panic. But if we do not want the further curves, we do not want more cases, we should be careful. I think that's what I would say.
Yes, Absolutely. In fact, Dr. Sanjit, if I can come to you here, Mumbai has seen a significant spike now, 700 cases plus for the second consecutive day, and the positivity rate also is quite high. Of course, the mask rule so far has not yet been made mandatory once again. But what is your own assessment of the situation here?
So what we feel is that the recent coronavirus wave that we are seeing is probably related to a milder variant of the entire virus. This particular variant seems to have an extremely good growth advantage, and it seems to be kind of evading vaccine-related immunity a little bit, is what it appears. I mean, we are seeing a large number of patients who've been vaccinated again getting a little bit of an infection. But the silver lining to the story is that none of them are actually getting seriously ill. None of them are getting seriously hospitalized. Very few of them are really getting hospitalized. And I think there are three reasons as to why we are seeing this kind of big spike. The first thing is the fact that probably our vaccination rates, which were initially very good, have actually started going down, which also includes the acceptance of the booster rate. The boosters also are not being taken on a regular basis now, is what I am getting to know. The second thing is the fact that the schools there was a huge amount of vacation that was happening, and people were kind of mobile, and crowds were there at many places, which is also maybe contributing to this particular spread. And the third thing is possibly the transmission because of variants that have got a significant increase in transmissibility, as per reports that have been seen abroad, where subvariants like BA4 and BA5 have actually shown a little bit more of a growth advantage, and thus spread is much more easier. And of course, the relaxation of curbs that we had practically because of the fact that we have so much of mask fatigue has also contributed to this. But the good part again is that there is no need to panic. In Mumbai, we are prepared. The only amount of beds that we're using is not more than 0.4% of the total capacity that we have. So no need to panic at all is what I feel.
All right. Dr. Goyal, of course, both of you are of the opinion that there's no need to panic right now. And obviously, people need to maintain the protocols and COVID-appropriate behavior. But do you see this trend continuing? Because now we've been seeing a sustaining rise going for the last few days. Do you think that we could be at a stage where we see the cases considerably spike up going forward in the coming weeks?
We need to keep on observing this. We can't say that this trend will continue, or the cases will increase, or the positivity rate will go up. We cannot say at present, because as I said earlier, that 200 crores are already vaccinated. As Dr. Sajid was saying, that this booster, people are not going for the booster dose. But still, I would say even if they have 2 doses, and this is about 6 months gap now, so they are almost vaccinated. So I don't think that this will keep on increasing the positivity rate. But yes, we need to be careful. Again, that we can't drop our mask, we can't drop the distances, we can't drop the hygiene. We have to maintain all these 3 COVID-appropriate behaviors. So, and in the previously also, maybe 2-3 weeks earlier also, we were seeing that there were number of cases were increasing, but then they further went down. And this trend is continuing for last 2-3 months. That's what we are seeing. So I don't think this may go further up. But yes, we need to be careful, especially, I'm again saying, especially people staying in indoors or outdoors in air-conditioned environment, in a closed environment where there is a lot of people around them, where the air is being circulated, which is causing panic. If one person is infected, it can infect 25 persons. In air-conditioned environment, please open up your windows now and then, so the air circulation, the air from outside comes in, and it is not the air which keeps on circulating in the closed environment. That may be one reason of increasing cases. So we need to further go to the basics. Like how should we live in an air-conditioned environment, the mask, the distancing, the hand hygiene. And of course, in the night, you should don't use air conditioned if there are 10-12 persons inside that.
Right.
Please open your windows. And that's what I would like to say.
Right.
Yeah.
Right.
Again, as your question is that whether it is going to go up, it may or may not be, but we need to keep on observing whether what is the positivity rate, what is the admission rate, what is the bed occupancy of oxygenated beds. That's what we need to observe for the next few days.
All right. In fact, Dr. Sanjit, if we look at what's been happening in some of the other countries, we did see another COVID spike, and if we look at past experience, India has usually followed other countries. If what would be your own assessment of that sort of a trend once again? And my second part to that is some other countries have also decided to declare COVID an endemic. In fact, there is not much importance being given to rules, to COVID appropriate behavior or testing. When do you think we could possibly be at that stage?
Yes, so Avni, that's two fantastic questions. The first question is the fact that is it going to follow the West or the other countries? Yes, we've seen that. All the waves that we've had has been 2-3 months delayed from what happened in the abroad countries. But so then we should be actually taking cue from the fact that none of them have actually become extremely severe. None of them have actually got very massively overwhelmed their healthcare mechanism. So it appears that the existing variant or sub-variant are definitely very, very mild. But that does not mean that we do not take appropriate precautions. We have to stay vigilant without panic. We have to protect our vulnerable. We have to keep a close watch on the hospitalization, as Dr. Really just mentioned about it. And I think we will also go up in a wave, but we will not be a wave that we saw in Delta or the other variants that we had. It will be a mild kind of infection that people will have. There may not be hospitalizations, and the people might not get seriously ill for certain.
All right, we'll leave it there. Thank you so much, both of you, for joining us and giving us your perspective on this.